Before I even answer this question about the insurance companies being expensive, people are saying insurance is a scam, it has a limit, etc. Let me first tell you a short story. So I've had a patient before, not even one or two, and this gentleman had this child who was not like sick but manageable sick at home. They have their on and off illnesses. However, this one time the child got very sick and they were going for UNEB exams, right? So it was an abrupt thing. You're not expecting that to happen. The child got so sick, he couldn't breathe, and we had to get the child into insurance. Hear me, insurance, into ICU. Now we tell the father, you need ICU like right now because we can't support anymore. You're bugging the child to maintain the oxygen up. The child is simply not able to breathe. So you needed a definitive airway. That is standard operating procedure. You needed ICU like now. So we told him the prices, like I've told you, the prices of ICU of any child who is above 1 month, who is out on neonatal age, is anywhere between 1 million to 6 million per day. So of course nobody, okay, anyway, I don't say nobody because there are some people who have their money, but an average Ugandan can't just pull that kind of money out of nowhere. But you know what helped this man? He had insurance. And you know, at that time, he wasn't sure whether the insurance, I think something about had covered the child or something like that, but he had gotten an insurance package. And so what it is that we did, we're like, you know what? Let's get you into the ICU, as in the meantime, we start trying to make phone calls to your insurance company. 3 days later, the child was out of the ICU. The child missed exams, but do you know what happened? She survived and she did not die. And this was in view of having some sort of income. Because let me tell you the truth. ICU, they will not allow you to enter. Like, you simply cannot enter. The only people that they can make exceptions for are, for example, I think if you're like a staff of the hospital, you're a fellow health worker in the hospital, that's when they can make exceptions because they know you as an individual. Now, there are so many times, there's a number of hospitals where you sit in the meetings and the hospitals are trying to regain money which they lost from patients that failed to pay the money. You find a patient has been in the ICU for like, let me say, 3 months or for like 4 months, and that patient eventually dies. Or lucky, some of them do survive, and you find they're demanding them like 200 million. 200 million, the patient's family and the patient have simply failed to pay, and that is a lot of money. The hospital does understand the patients where they fall, but they've also put so much resources in there, in that you find that staff are demanding for their pay, the drugs are supposed to be paid for, the machinery needs to be serviced, it's a whole thing. So first of all, when you go saying things like, it's because the government hasn't catered, if the government could do better, guys, we are in a broken system. It's important sometimes that we be in the reality. We're in a broken system. Even if you go to government facilities, and I have worked in government facilities, I have practiced there, I have been placed there before, and I've worked there in different government facilities for a total of 4 years. So I know what goes on there. A patient can die because they don't have a cannula to get a drug. Like, that's how bad things can be. You find a plan maybe for like 2 million people or something, then you find you're having a waiting list of like 15 million people. So you're not going to expect that someone is going to now, like, things are going to somehow become better just like that. But the thing that we can do is to fight for ourselves as individuals. And so what for me I do as a health worker who sits in the on ground, because the thing is, if you're a person who hasn't yet had someone that is in that position, you can't understand that position until you get into it. And it's just a matter of this, like, literally, it's just a matter of this. There was some gentleman, there's some comments that you can't even respond to, who said something like, how can I pay 6 million for a child, and even if I have it, what do I want to? Sometimes you just be like, anyway, let me just break down for you a few of the insurance premiums. I am not so sure, this was just based purely on finding information from the internet, but I want to give you an idea of how it is that the average is. So for example, there are some insurance companies that even us as doctors, when we see a patient is under this insurance, we are like, yeah, at least I know that I am not limited in how it is I have to care for. Because, for example, there's some companies where there's some drugs I can't give you, some procedures I can't do, or you find a company also stresses us, like, it stresses us to be able to cater to the patient. You find we have to first send pre-authorization, and then the company takes like long, then they ask you for this, and you know for sure I'm going to suffer. But that is better than when someone completely has nothing at all. Now let me break down for you a few covers. For example, this is just purely from a research from the internet. I may be wrong. Please, by all means, feel free to comment on the right caps or whatever if you're the insurance company. And if you'd like to expound more on this, you can come and be partner on how it is that we can share this information as an insurance company and for the health people. So I'm going to begin with some of the companies that are my personal favorite. There's an insurance company that I only saw, I think, like twice, but the people that it was covering were people who were employees at the time of the United Nations, and that was henna. Henna was just like henna. The times I would see a patient under henna coverage, I would just say, thank you, Lord. First of all, the questions they ask you are few. The things they cover are much more. But of course, you must understand that the rates are going to be higher. I don't know, but I've only seen the people who I saw who were under it were for the UN. And then also when you see Liberty I think has 2 subgroups, but also the Liberty covers tend to be really, really better. We're able to do a bit more for the patient with the coverage. Then there are others like UAP, Prudential, Sanlam. It really depends. And also if you're on something like copay, it means that everything that we do, over some of the things that we do, you must pay a certain amount to top up. So again, we are limited, especially if you're not able to copay. So I've got something a bit rough from the internet. Seeing here, Liberty, they have individual premium and family premium and the coverages. Now for the Liberty, the premium ranges from 500,000 per person per year to 3 million per person per year. This is individual coverage. Then the family premium is 1.5 million to 6 million per family. I think they give you like a family cap, maybe like 4 people or 5, I don't know. And it will have coverage like inpatient, outpatient, dental, evacuation. But then the inpatient is usually higher than the outpatient, which makes sense because inpatient, obviously, they're spending a bit more. So Liberty has 500,000 to 3 million. UAP, I'm seeing 400,000 to 2.5 per person, and the family is 1.2 to 5 million per person per year. Then Prudential, 600 to 3.5. Then the family, I think I'm seeing customized. Then Sanlam, that is 450k to 2.8 million per person per year. Then family is 1.8 to 6.5. Then Henna, 300 to 2 million per person per year. Then the family has, I think, group rates, and they give you, I don't know, this could be a very rough estimate, I'm not very sure. And then I think now also I got something about the average range of the expected government proposed national health income insurance scheme, and they are giving something about proposed premiums. The formal sector employees to pay 4% of salary shared between employer and employee. Informal sector to pay between 100,000 to 200,000 per year, subject to change. And then vulnerable groups, e.g. the elderly and very poor, are subsidized or free. Now let me tell you something. This is just basic maths. You're going to go and say health is a business or whatever. For us, those of us who are doing health out of passion, we are not able to build new hospitals. And even if we were, I'm going to give you another cost estimate of the machinery and how they are maintained. And then you know that even the business people, they can't sleep. So, if let me say, for example, let me just extract, for example, Liberty. Okay, let me say something like, let me say UAP, right? If the individual premiums range from 400,000 to 2.5 million per person per year, and then the family premiums are ranging from 1.2 million to 5 million, you do not expect that a person paying 5 million for their family per year and you who is paying 1.2 million, that the coverage is going to be the same. If you're an individual, a person who is paying insurance for themselves of 2.5 million per year, and you who is paying 400,000 per year, you can't expect that the financial limits is going to be the same. This is just basic math. So they're going to tell you there are some services that they can't offer you because the amount you paid is less and the other person, the amount they paid is more. So your financial cap runs out. The same thing if you're someone who keeps on going to hospital for this and that. When problems finally come, you find your insurance is already running out when you actually need the biggest amount of money. So these are the things that we need to know. This information I give you, take it as you wish. If you don't want it, by all means leave it. It's meant for those for whom it will benefit. Otherwise, I hope that is very helpful for you. I'm going to try to answer as many questions as possible because it's something which really pains me. Sitting and watching a person that you love die because you can't afford, that's a different kind of pain. It's horrible.